And welcome back to Life on a Hearse. Matt Delvecchio here, specializing in home care, elder care planning in the senior living industry. Thank you for tuning in. Hope you're enjoying this beautiful sunny Sunday. Hey, shout out to the city of Kirkland as they hosted their annual seniors fair today. I was there with our team exhibiting at the fair. Great show, and thanks to all the organizers in their efforts to promote the health and well-being of seniors. And I also want to give a shout out to the city of Pierrefonds. My wife, Stephanie Cadu, and I are featured speakers this Wednesday, October 1st, which happens to be National Seniors Day. We're presenting on the topic of aging at home and navigating life transitions. That's this Wednesday, October 1st at the Pierrefonds Cultural Center. It's going to be starting at 2:30 p.m. for our presentation. All right, just before the news, we heard from social worker Marla Overland about a caregiver support. And I asked her to join me for this segment as well because we're going to be discussing how to access CLSC services. And Marla, for our listeners that are just tuning in, you worked at the CLSC for how many years now?
33.
33 years. You say it sheepishly, and you
Yes.
should not. You've got
Okay.
a ton of experience, and I'm so glad to have you here in studio with me to share
Thank you.
some of this experience to our listeners. Now, resources are stretched to the limit. We're seeing that. Budgets are being cut. Staffing issues remain a concern. So I appreciate you sticking around. Now, what types of services for seniors are typically accessed from the CLSC?
Well, generally, people are looking for home care support, so direct daily support, relocation, so placement in a public sector center, respite as a caregiver, information about available resources, and times an assessment of client competence for an overall evaluation of autonomy in light of a protection mandate.
All right. And time again, I hear it can be challenging to just even get some of these services, even get an evaluation. So what does one do to get these services?
Well, there are two main access points directly to the CLSC. First, a person can dial 811 with option 2 and speak with a social worker to have a referral to a resource in the community. As well, people can walk into their CLSC. If they go online and punch in their postal code, they'll be able to access their CLSC and be able to actually visit with a intake social worker who will take the general information. It's important to note that it seems obvious, but people need to be armed with the proper information when they're going to make an intake. For example, a Medicare number along with an expiry date or the proper date of birth of the person they're asking the services for. I mean, these seem obvious, but it's very important to make sure you have numbers, email addresses, everything on hand. Another way a person can access service would be through a hospital center or a government clinic like a GMF, where a client would access the service and then they would assess that the client would have a need for CLSC, and there's an internal mechanism to refer.
All right, so it's the medical clinic or the doctor that's referring to the CLSC. Some say that's maybe the most efficient way of doing it, but don't forget there are CLSC centers with phone numbers, so you could just walk in, right,
Yes,
if
you
you want, and you have the right to do that. All right, talking with Marla Overland, social worker and team lead, caregiver support and counseling for Lianas Senior Transition Support, longtime CLSC worker as well. Let's expand on accessing home care services specifically, Marla, okay? This is in high demand from the public as our population is aging. And so can you provide some examples of the type of home care that the CLSC can provide?
The CLSC provides direct home care assistance to supplement a loss of autonomy. So that's with activities of daily living such as meal preparation, showering, medication compliance, or dressing, or activities of domestic living, which would be cleaning and shopping, whereby the CLSC would make a referral to a community resource. But as well, you can access professional services such as a social worker or a nurse who can follow your medical situation, a rehab a professional, an occupational therapist or physiotherapist, a nutritionist, or a auxiliary worker who would give direct care. It's important to note that most clients are given a case manager or pivotal worker who will follow them throughout the system to avoid people having difficulty navigating along the way.
Very important. And, as I'm listening to you, I know there are some listeners here that have struggled to get any of those services, but it's so important to keep advocating, try to get that caseworker that could help break down some barriers for you. All right, continuing along. Now, the other service that you mentioned besides home care, a very popular one, is trying to get a loved one into a public long-term care residence, or what we are known as a CHSLD, Centre d'Hébergement de Soins de Longue Durée, or a Ressource Intermédiaire, an RI, sometimes referred to in the industry, a level below CHSLD. So what's the process to get a loved one into a public long-term care home?
Well, it starts with an autonomy evaluation by a nurse or a social worker. And it's a lengthy...
Within the CLSC, right?
Right. Yeah. And it's a lengthy evaluation in that we're trying to capture a snapshot of the person to best describe what their needs are. Once that evaluation is completed, it generates a number, and that number corresponds to the type of placement that person would best benefit from, be it, as you said, an RI or a CHSLD, or it can also be an RTF, which is a community resource, actually, where people reside in the community with a maximum of 9 residents, and there's a staff. And it allows people with a slight loss of autonomy to have the services they require in a placement setting. Once these applications are finished, we put that together with medical and other information, and we send it to a general area in the system called the MAH, Mécanisme d'Accès à l'Hébergement. And here the dossier is studied to ensure that the orientation requested by the family and social worker are best for the client. And after that, should all go well, the client is waitlisted for the particular CHSLD or RI or RTF that they're going to require. So
they're given a choice from the social worker or the caseworker. Here are the local residences in your territory. You pick 2 or 3 of them type thing?
Right. Generally, I encourage clients to pick 1 or 2 so we can zero in on something. And as well, I urge them also to tell me if there's any changes, because the system listens when there is a change. We advocate for our clients and we let them know that there might be a change and there might be a need for a change in priority.
Because waiting lists aren't based on first come, first serve. Waiting lists are based on priority.
Exactly.
So the waiting list could be 1, 2, 3 years even in some places. And then in the meantime, you may have to go into a transition bed, which you don't have a choice in, but at least you'll have a choice in for your permanent bed. All right. Talking with social worker Marla Overland about the challenges of accessing public healthcare systems. We get that a lot in my world, and we're trying to help out with some advice here. What's the most important piece of advice, Marla, that you can give to someone looking for CLSC assistance?
One word: communication. It is very important to talk with your social worker, to let your social worker know of any changes along the way. The social worker, the CLSC, and the family and client work as a team. And though we visit quite often, I could be visiting a client on Friday and 2 days later something comes to pass. And even if you think it's mundane or minutiae, it's very important for family and client to communicate with us because we act accordingly.
Okay, very good. Communication is the key there in advocacy. We're quickly running out of time. However, there are families that may be going through everything you're recommending and still struggling to get some services. I mentioned before our news update, there are still many community resources, municipalities. It's worth repeating a couple and maybe some new ones. Where can we go above and beyond the CLSC?
Well, you've mentioned Nova West Island, and they're a great example because they have a day center to ensure that the clients have recreation and socialization as well as respite for the caregiver.
I might also add there's Nova Montreal
yes.
and Nova Western, so they cover a lot of grounds.
The Alzheimer's Society is another example, AGI. The Alzheimer's group, and the Cumming Center for Seniors. That
Love
offers,
the Cumming Center.
Yeah, they offer home care. They have a host of different activities, lectures, and courses of interest for people. As well, there are volunteer centers throughout Quebec, and they would offer friendly visits, transport to medical appointments, activity programs, and assistance with shopping and errands.
Very good. Well, we're out of time. Thank you. I'll also add in your local municipalities. Reach out to them. There's more and more seniors groups, seniors clubs in the municipalities. They may be helpful as well. Marla, thank you very much. How can our listeners get a hold of you?
Online at www.lianasservices.com, Lianas services.com, or by telephone at 514-622-8074.
Marla, thank you very much, and coming in studio in person to share some really good advice here. That's Marla Overland, Team Lead, Caregiver Support and Counseling for Lianas Senior Transition Support.